In this scenario, a child and mother are playing outside. The child falls off her bike and gets a cut on her wrist. The parent will use the sick P steps to determine if the child needs to be cared for at home, needs a doctor appointment, or needs to be taken to the emergency room.
Oh no! You're okay. Let me see. Let's look. You're okay. I don't think it's an emergency, so we're gonna go inside and clean you up. It's okay. I'm just gonna clean you up. Gonna feel better.
The child's mother has cleaned up the infant's cut first and is now going to check the health manual to review the sick or injured child chart, or the sick P steps. As we heard the mother decide outside, this is not an emergency. The child's cut should be cared for at home, so the mother is now going to fill out the health recording chart after checking for other symptoms in the health manual. Over the past 4 hours, the mother has observed her child's behavior and watched for symptoms to become worse. She fills out the health recording chart again to keep track of her child's symptoms and behaviors. Since the cut was no longer bleeding and did not look infected, she decided that caring for her child at home was the best idea. If you're unsure to care for your child at home or take them to the doctor, you may call your doctor to be on the safe side. Have your health recording chart ready to make recalling your child's symptoms easier when talking to the doctor. In this scenario, the child fell off her bike and cut her wrist. The parent decided it was not an emergency. She cleaned up the cut and checked the health manual, then filled out the health recording chart. The mother checked for other symptoms in the health manual and made sure her child's symptoms did not worsen over time. 4 hours later, the mother cleaned the cut again and recorded that it was not bleeding anymore and her child's behavior was normal. This scenario showed an example of caring for your child at home.